Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. On our program today, we'll be talking about hepatitis in the midst of COVID 19 for the past 2 years or more, and now we're on the verge of starting activities and programs for monkeypox. World Hepatitis Day is with us, and we've got Dr. Tariq Jagnarain. He's the program manager of the National AIDS Program Secretariat, and Dr. Sidel Fernandez from the Georgetown Public Hospital, the Internal Medicine and Infectious Disease Unit. Doctors, welcome to our program. Dr. Jagnarain, we're inundated with COVID. We're now talking about monkeypox, hepatitis. Why is it important, especially this time, and why WHO made it an important disease, as the case may be?
Thank you, Nazim. Thank you for having me. So hepatitis, like many other infectious diseases, it has a high burden in terms of health impact. For example, you have almost 354 million people worldwide that is infected with hepatitis B alone. It's estimated that given over the years, so almost 2 billion people would have had hepatitis B. In terms of hepatitis C, you had over 58 million persons suspected to be infected with hepatitis C. And it's one of the leading cause of death, hepatitis, with version of it from A to E. Almost 1.34 million people die each year. And so when you look at those numbers, it is causing a huge burden in terms of health impact. Persons are being affected, many vulnerable groups, and so we have to focus on it. So come 28th of July, we would be celebrating World Hepatitis Day under the theme bringing hepatitis care closer to you. And so we're excited.
Over the years, a number of years, hepatitis was not really a buzzword. We've got HIV, TB, malaria, now COVID. These have all been buzzwords. We never heard much about hepatitis. What's the status? What's happening out there in Guyana?
So we've been doing work with hepatitis. I mean, there is the hepatitis B vaccine we've been given towards our healthcare workers or anyone who needs to have it, especially like barbers and cooks. We have been testing for hepatitis at the National AIDS Program, not as much as we want to, but as you rightly suggest, a lot of persons themselves are not accessing tests for hepatitis. There have been some limited resources in terms of treatment availability. It's very costly, and so now I'm happy to say that the Ministry of Health would have procured testing for both hepatitis B and C, as well as treatment that not only get rid of hepatitis but works as a 98% cure. And so they're all available, and it's part of our launch for the World Hepatitis Day.
You're talking about that hepatitis spectrum from A to
E. Yeah.
Which one do we have prevalent here in Ghana, you think?
So we have all. A to E are prevalent, but the more dangerous ones are the B and C. They're transmitted similar like HIV, but the problem with those is that they can cause a lot of what we call extra liver or extra hepatic illnesses like cancers of the liver, cirrhosis of the liver, and so because of that, it can impact a person's way of life if they get hepatitis. Sadly, too, Nazem, is that hepatitis is one of those diseases. It can go for years undetected. And because of that, many persons, they're unaware. And if you think about some of the vulnerable groups like drug addicts, or even persons who share needles, persons who receive tattoos, young girls, women, homeless people, there's so many ways they can get hepatitis. But the issue is, by simply having a test done, you can be treated, and at the same time, you can be cured.
We're going to come across to Dr. Fernandez. Dr. Fernandez, Dr. Jagrain was speaking about hepatitis A to E. And tell us the population, almost everyone, can be at risk. What are the factors that can create that risk?
So the person, just to add what Dr. Jagrain said, the persons who are at risk of contracting hepatitis C particularly are those who are immunocompromised, particularly those with HIV. That's one of the risk factors. Healthcare workers are also at risk, particularly those who would have gotten stuck by a needle or by any sharp. Those that would have received blood transfusions or organs before 1986, before we were doing rigid screening, are at risk of developing hepatitis C. Those are some of the most vulnerable ones, along with patients who have hemodialysis. Those are the vulnerable populations.
And with symptoms,
Yes.
we know in these days and age
Yes.
we are looking for anything now.
Yes.
To look at signs and symptoms of diseases, HIV, regardless. When we come back after the break, we want to talk about signs and symptoms of persons with that spectrum of hepatitis. Stay with us. We will be right back after these messages. Welcome back to our program. We're talking about hepatitis, World Hepatitis Day in July, and I've got Dr. Cyril Fernandez. We've started off with Dr. Tarek Jagarine from the Nationalist Program. And Dr. we were talking about signs and symptoms, and Dr. Jagarine interestingly spoke about the liver being affected. We'll talk about the liver, but let's hear some of the signs and symptoms and, maybe some things we take for granted.
Definitely. So the thing with hepatitis C, the vast majority of patients are asymptomatic. About 80% have no signs and symptoms. And that's why when we have an acute infection, it's often overlooked. Right? Because we have no signs, we don't go to the doctor until it reaches to the chronic phase when they have some of the complications. Things that you can look for is jaundice. That's basically yellowing of the eye or the skin. If you have any amount of abdominal pain, so that's one of the things that, might take patients to the hospital. When the stool changes its color from being the normal dark to more pale color appearance, those are some of the most common things. And once you go to the hospital, doctors will check for laboratory findings in which we will have the liver enzymes very elevated, along with like the bilirubin and other testing that we would check for.
Doc also spoke about, very briefly, Dr. Jagarine, about how you can contract hepatitis.
Yes.
If we get some more details on that.
Yes, so hepatitis C is a blood-borne infection. So it's mostly transmitted by blood and blood products. So you can have it from sexual intercourse, and it can be heterosexual or homosexual contact. You can get it from that way. Blood transfusion, but like I said, it's not as common as it was in like 1965, around there. 1985. Other ways you can get it, mother to child transfusion, you can have it that way. And healthcare workers, we're at risk because if you come in contact with anyone who would have had hepatitis C and you get stuck by the needle or by the sharp, you can contract it that way. The other population, the IV drug users, whether we share needles, a lot of times the guys on the street who uses, different drugs, they use the same needle. You can contract it that way. And also by tattoos. So once the tattoo artist reuses the needle, you can definitely contract it that way.
And I guess maybe people in other occupational exposure,
Yes.
not only in the clinical setting,
Yes.
wherever there might be a blood flow.
Definitely, because it's a bloodborne disease. Once there's any contact with contaminated blood, you can get the infection. So we
Right.
should be careful.
Dr. Jagarin, on World Hepatitis Day, and this program is broadcast on World Hepatitis Day, the ministry is moving rapidly with a robust program and beefing up its program with a launch. Tell us about that.
Oh, definitely, Nazim. Something that both Dr. Finance and I, as well as the Honorable Minister of Health, we're excited
Yes,
about.
very much.
We're going to be launching the first ever hepatitis clinic in the Caribbean. A clinic where we're not only going to focus on hepatitis C, but hepatitis B. We're going to be doing extensive testing. We're going to be provide treatment that are pan-genotypic, meaning each one of these viruses, they have subgroups. And initially, when they used to treat them, they use specific treatment regimen for each subtype. Now we have treatment that can work for all. We're going to ensure that these are treatment that you're going to get where you're going to have follow-ups. You have a percentage chance of 98% to have a cure, especially for hepatitis C. You're going to be having specialists present to see you, gastroenterologists,
Yes.
hepatologists, and this is going to be right as part of the National AIDS program through the National Care and Treatment Center. And we're going to open it for everyone. First of all, we want to focus a lot on the persons who would have donated blood. We would have found a few of them would have been positive for hepatitis B and C. And so we want to treat them, their partners. And then from there, we want to take testing to the people. And so, as you know, NAPS would have always started in 2021 having STI testing at the 50 VCT sites we had. Testing for syphilis, gonorrhea, chlamydia, but now we're going to include as part of that package hepatitis B and C. Once you're tested, if you're positive, we link you to our treatment where you can actually start receiving care.
And as you launch, would this be a national program right across, or it might be just limited for a certain area now and then increase in geographic location?
So there's a goal of, for now, in the next few months, we want it to be national, but we want to take it to the region because each region now has to have this level of ownership. And so by having, hopefully, our gastroenterologists or
Yes.
hepatologists go to the regions, they now can see the cases there, which in some regions might have higher prevalence than others. Based on what Dr. Finance mentioned, you remember they have various groups that are at risk. And so in some areas, you may not have none of those groups, but in some areas, there's a higher prevalence.
Is this rapid test, or you'll have to wait?
Both of them we're doing. We have rapid tests, but we're also going to be looking at viral load testing or serial testing.
Because
And
I
so-
know, because I know with the National AIDS program, you do have outreaches
Yes.
for HIV and some of the STIs
STIs.
Testing, rapid tests. So that's why I asked the
They
question.
are rapid. Yes.
So you will have that option also.
Rapid, they're very, they have a good a high level of sensitivity and specificity in terms of the results.
Yes.
We don't have to worry that, maybe you can have false results. So yes.
And then what happens after? Is usually referral navigated to a hospital?
Well, immediately we'll direct you to either one of our care and treatment sites because ultimately we want to train all of our clinicians in how to treat hepatitis, and not just our clinicians. We want to step away a bit. And hepatitis is something so simple. If I have a test and I'm positive, there's only one treatment for either hepatitis B or C. There's then this host of regimen that you have to use, and so even nurses and the pharmacists can start testing these persons, and they can be followed up eventually by the clinicians. And so they would be linked to either one of our 28 care and treatment sites that we have.
Because I have you on the spot right now, that's on a national scale, but you just had some bit of exposure on the international scale at a recent gathering. Tell us about that.
So I was happy to be part of a group of experts from Latin America that discuss some of their best practices when as it has to do with hepatitis, especially C. And some of the things that you had coming out is the fact that they love the use of these general treatment regimen that can treat all of the subtypes. But the key points that they brought out was to look at how you look at drug interactions. Like Guyana's population, many persons, they self-medicate. And yeah, that's true. They self-medicate. When they come to you, they've already tried several things.
That's
and so we got to be careful when we're using these drugs to check always. That's one of the key points that popped from the conference. And then look at your vulnerable groups and go to them. And if anything COVID has taught us is meeting the people from where they are so you can take tests and treatment to them.
You just talking about COVID, and Dr. Fernandez, we spoke about it, hepatitis. Hepatitis with someone who immune system is compromised. And then on top of that, you might have COVID also.
I know.
Tell us about that scenario.
So with a particular patient, hepatitis C, with COVID, immunocompromised, these are the most vulnerable group of patients that we have. Those are the ones that are more prone to have severe disease and complications, sadly. Yeah, so we would see those in clinic. And
I think that's like a triple whammy. You give somebody one time.
I know.
That is something now, given current state of affair of health matters globally, you can expect. And then on top of that, Ghana is about to start, and that's another discussion, start the monkeypox program. So, you have every single thing coming at you at one blow. I'm quite sure this is really going to tell on the nerves of clinicians and medical practitioners. Persons now, when they find out, Dr. Jagarine, that people might think now any disease is a death sentence, and let's just say it's just hepatitis. And once you've caught it in the earliest, is it a death sentence? One caught in the earliest.
So many of these diseases, because of research, we have good treatment available, and so. Once you can detect it early, they're no longer life-threatening. They are life-changing. I mean, nobody wants to be sick, but they're no longer life-threatening. Even HIV. And so once you're positive, you have to be in that treatment. One of the things we got to be worried about the most, I want to point out, is that hepatitis B and C, over 70% of the cases with, in terms of patients, they don't always present with having a liver issue. They can present with what we call extrahepatic symptoms. And it might be very atypical, something that you didn't even realize, a change in your nail color, a change in your stool pattern, a simple change in some unusual lesion on your hand, your blood tests. You might do a routine blood test, and it tweak a little bit, and so you need to check. And it comes back to the point you were making earlier. We are so much at risk of getting almost anything.
That's true.
That we need to start doing regular checkups. Check in, see how well we're doing. And
I was about to make that point in our final segment, and it's only recently you were talking about it. We are not a people who do annual checkup in the case will be. So I will leave that for the next segment for you to really drive home that point. But we're looking at, the liver, and I've heard that buzz. And we in Guyana, we do things, alcohol. And so if we don't have hepatitis, is it the time now for Guyanese to really change their lifestyle in terms of what they do, in terms of putting pressure on the liver?
That's true. And not just the alcohol use, which a lot of us sometimes abuse, different medication. There are a lot of hepatotoxic drugs that we just use recklessly. So that's something that we as Guyanese definitely need to get under control.
If I may add to Nazim, is that we live in a culture, the young people, they're changing a bit, and so they practice a lot of chemsex and recreational drugs.
That's true.
And these drugs, do a lot of them, the methamphetamines, and they combine them with some of the psychoactive, psychotic drugs. And they themselves expose your risk of getting hepatitis.
So from an early age, you're putting pressure
on the liver. Along with the alcohol, that's the next thing they add.
Right. We'll take a break, and when we come back, as we wrap up our talk about hepatitis, I just want both doctors to talk about the importance of lifestyle, and including that lifestyle in getting regular checkups. Stay with us, we'll be right back.
NCD.
This is Ray. Ray is at a community screening where he is waiting for Doc.
who tells him he has hepatitis and advises him to come to the health center for follow-up. What should Ray do? Ray skips his checkup and hangs out with his friends instead, and goes to work and everywhere else. In the fun and the hubbub, Ray forgets to go to the health center. Over time, he observes that he's been feeling sick. Worried, he sees Doc, who advises him to undergo further tests for liver disease and scan for liver cancer, with unfortunate results. Do you want to try again? What should Ray do? Ray goes to his health center for follow-up, where Doc conducts further tests to determine the state of Ray's liver. With his friends, he abstains from drinking alcohol, maintains an active lifestyle, and eats healthily. He also goes for a regular checkup. He gets scanned for liver cancer. And it turns up clear. By maintaining a healthy lifestyle and seeing his doctor regularly, Ray remains healthy, with low risk of liver cancer.
Welcome back to Health Matters. Reminding you we have Dr. Tariq Jagnurain from the Nationalist Program and Dr. Cyril Fernandez from the GPHC. Dr. Jagnurain, a little buzz recently talking about One Health program. Tell us about that.
So the ministry under the Honorable Minister of Health has been promoting One Health, persons where they need to get not only routine checkups annually, but you can go to one clinic setting and you can have everything done in one space. You don't have to be going multiple times. So you can get a blood test done, you can know your pressure, your sugar, and at the same time, see a clinician, receive treatment, and to be continued followed up. And so that's a big thing. I think a lot of persons out there, they fail to get checkup. Men especially, Nazim, I don't want to put you on the spot, but if you ask an average of 100 men when last they had a health checkup, they would say most of them, 60% plus, they haven't. And they wait until it's late. Many of them would wait until the symptoms is bad and then they get out there. And then you have the working group too. Many of them, they prioritize work and they don't want to go and see a healthcare specialist or even a nurse or a social worker. And so ministry has been promoting persons to eat healthy, live healthy, reducing smoking, drinking, exercising regularly, and seeing a clinician.
Dr. Fernandez, the whole idea of pushing people to seek health care, people will have all sorts of excuses. And mind you, we spoke earlier on people self-medicate, not only going to a friend who's got a pharmacy, but even using indigenous medicine or bush medicine, as we would like to say. Why is it important that we really, participate in a very regular health check?
Yeah, so as Doc would have mentioned, early detection of these disease gives you the best chance of curation or curing that disease. And we can't wait until we actually get the complications, then come to the hospital. So I think it's important for all gynaes, especially the vulnerable population, to get regular checkups. And don't wait, do all, see everything, go to the pharmacy, your neighbor, your friend, everywhere before you actually go to the healthcare facility. There are clinics available at your disposal and you need to use them, right? Using the One Health program that Doc just mentioned, it is available for every one of us and we should seek healthcare as early as possible.
Well, the ministry, Dr. Jagnurain, has really, indicated they're going to have smart hospitals, new hospitals. They're aligning themselves with leading hospitals in the United States to bring their program here. And as the case will be, your take on, pushing people in to getting quality. Well, one, look at their lifestyle, and two, including in that lifestyle to have annual checkups. I know people who have insurance policies will want to do that, but generally a man in the street, who really go after a reckless lifestyle, somehow they don't take care of their health.
Definitely, and we all should, because no one is aware of what can happen to them tomorrow. And so the best way to know that is by prevention. Prevention is always better than cure. And so by having checkups done regularly, checking in with your physician, maybe it doesn't require a blood test, but just simply sitting and talking to your clinician, it can help you not only physically with whatever's happening, but often we need mental health checks too. And so by tapping into that, you can have that help that is needed. And often they might give you resources that you didn't even think of. We live in a society where there's a high prevalence of diabetes, hypertension, cardiovascular problems, and infectious disease. And so when we want to live longer, look what's happening in Guyana. We're developing well. Look at our recently launched Building Expo. I would want to live to see the next 100 years in Guyana if possible. But then we'd want to live healthy, happy, without any kind of illness. And so the way to do that is by having checkup, living healthy, and practicing good, healthy lifestyle.
Dr. Fernandez, as we wrap up our program, let's walk us through again what people who think that they might have put themselves at risk of contracting hepatitis, or what should they do? Just so you can walk us through.
Yes. So if you think that you or someone that you know may have been at risk or may have contracted hepatitis C, so the first thing you can do is to go to your nearest health center or your the hospital, see a physician. There you can have an interview, physical examination done, and then we will order the most appropriate laboratory testing. Once we find hepatitis, whether it's A to E, then we have treatment available, like Dr. Tariq just mentioned, to treat you. Right? So there are things in place, but you just need to first go to the healthcare facility to initiate this.
And Dr. Jacqueline, this will also come under the NAPS program?
Yes, it is under the National AIDS Program Secretariat, because our program, we don't only look at HIV, we look at STIs. And the hepatitis, principally the B and C, are considered as STIs.
Yes.
They have some other versions, the A, the D, and the E.
Yes.
They can be acquired through food and other sources, but we're still going to look at those as well.
And those are more short-lived than
Yes.
Dr. Jacqueline, Dr. Fernandez, thanks a lot for being on our program.
Thank you.
And I do wish you luck, good luck and hard work, no doubt, in the near future. This has been Health Matters. I am Nazim Hussain. Thank you for watching. Do join us again next time. Until that time, be safe.
Thank you.
Thank you.